Hello everyone, and thank you for joining us in another session of our spring event in Academy of Oral Surgery. Today we have with us Dr. Arash Hakhamian, which I will read off his credential momentarily. I would like to first share and just go over that today. Again, it's the second day of our virtual conference. Um, so Dr. Hakhamian will be talking about Uberization of Dentistry, and also want to talk about the uh, the membership that we're offering. 1 year free, or the first year free membership for the Academy of Oral Surgery. We're very excited to announce that we had 500 new members just this past month, and you guys are able to join this, use this free membership. There's this coupon code that you would have to use called the Global Summit at the checkout when you go to oralsurgery.org and slash register. Also, wanted to talk about our International Extraction Academy workshop. We used to have a dozen of these every year all around the United States, and so we kind of stopped that with COVID. Now we're barely just starting them back on. So you guys can get it as a part of being a part of the member of the American Academy of Oral Surgery. You guys are able to get a 50% discount by using the code AOS 2021. So I definitely recommend you do that as well. So with that all said, I would like to introduce Dr. Arash Hakhamian. Is obviously it doesn't need an introduction. He's a very well-known cosmetic and implant dentist, a graduate of UCLA and USC. Dr. Hakhamian teaches advanced techniques, surgical techniques in dental implants and grafting, as well as business management and marketing to the dentists around the world. And Dr. Hakhamian also is serving as a CEO of Dentulu, a technology company providing mobile dentistry and teledentistry services. And also Dr. Hakhamian is involved. We are honored to have Dr. Hakhamian as one of our regents in Academy of Oral Surgery. Very involved with the fast track program, which you will cover in this session. That is helping all of our emergency rooms basically and diverting these patients that they in need of dental basically treatment to the dental professionals and away from the emergency rooms. So Dr. Hakhamian, it's a pleasure to have you.
Thank you, Dr. Javi. Pleasure to be here. Thank you for all of our audience and for the Academy for putting this on today. It's going to be a little bit of a transition. I'm usually lecturing on surgery, as you mentioned, but really today I want to talk about the Uberization of dentistry, which is so relevant and really will be shaping the future of our industry. We have a lot to cover, so I'll jump straight into it. Part of the thing we want to talk about is what is Uberization. And really, how does the Uberization of dentistry occur, and really how does Uberization pertain to what we are doing in the dental industry? Can we take characteristics that really helped Uber in achieving its massive market share and influence and really apply those to what we're doing? And can we help our patients and really increase the profitability of our practices? So I've had a quite a exciting career, third generation dentist. I really have enjoyed various aspects of dentistry, from teaching to volunteering to now working on technology that is going to be really shaping the future of the industry. Just some quick disclosures. I am the CEO of Dentulu. I'm an author, consultant, and lecturer on the topic of teledentistry. And really what you will see a lot of information that is shared today based on what Dentulu is doing, because nothing really exists out there that is really impacting teledentistry and mobile dentistry in this way. So you'll see certain slides from our platform, but full disclosure, I do have a vested interest in telemedicine and mobile dentistry, and really I'm an active participant in shaping the future in this space. So one of the topics of discussions today is, what are the use cases for teledentistry and use cases for mobile dentistry? How do we use teledentistry and mobile dentistry to get more patients through the door? Are there any financial opportunities emerging in the dental industry relating to these two new technologies? How can we increase our productivity, and really some future trends as dentistry continues to Uberize? Now, is this the future or is this the past? We are now getting accustomed to using telemedicine in the dental industry, but really, this is not a new concept. EKGs were sent in the 1900s, and really communication regarding patient information has gone as far back as the early 1900s. In 1910, we were using telephones to discuss patient information. We've used Morse code, and video conferencing was actually introduced and utilized for the purposes of telemedicine in the early 1960s. So if you haven't heard about Uber's a company that is grossing right now well over $50 billion in annual booking revenue. They have since actually increased that number. And interestingly enough, the first day I gave this lecture on the Uberization of dentistry was on the day that Uber went IPO in 2019. So let's talk about Uberization. What characteristics are we talking about when we speak about Uberization? Well, what did Uber do? Uber disrupted the market. In order to Uberize an industry, you must have mobile technology. You must allow the service to be on demand, and you must allow direct contact between the consumer and the provider, in this case, the patient and the provider, and really allow a freedom of choice now that is back in the consumer's hands for scheduling and other functionality. And Uber also has what we call a rating system. So now consumers or patients should be able to rate their individual providers and their experience. So we have the 5 C's I call of Uberization. One is the control, shifting the control back to consumers on where, when, and how they receive these services. And the convenience, which enables consumers and patients to engage with their providers on their own terms. Customer experience, where we ensure an improved customer experience, and I'll discuss about how we can do that in the Uberization of dentistry. Connection is another big one. This is now creating a direct connection between patients and provider, almost bypassing the front office and all the other middlemen that have previously been involved in the process, from patient acquiring, finding, searching, and then scheduling with the doctor, and finally speaking to the provider. And lastly, the comfort of having on-site treatment, whether it's virtually or through mobile dentistry. Now, the Uberization of various industries has been in effect for years, really. So we've had, obviously transportation sector that has been Uberized from years ago, but we also have companies like Airbnb, DoorDash, Zesty, Jet, and this is far-reaching outside of just the taxi business or the car ownership business, and really impacts real estate. And now we've seen this transition into dentistry. We have companies like Align Technologies, Smile Direct Club, Dentulu, Candid, the Teledentists, have now really made a meaningful impact and are really gaining traction. And so the Uberization of dentistry has already begun. We're also seeing a trend into wearables. These are just a few of the types of wearables and remote patient monitoring companies that have gotten involved in the medical side. And we are now going to see more and more remote monitoring capabilities in dentistry as well. And this will allow us to maintain a virtual connection and continuity of care with our patients even after they leave the office. Now, the acceleration growth in technology has been moving in an exponential rate. It's been really lightning pace over the last 2 decades, and technological advancements have crept into almost every facet of our life. These are just some companies like Facebook and Uber, Netflix, Amazon, Slack, and even Teladoc, who have really become an integral part of the daily lives of billions of people around the world. And the entire ecosystem has now changed as a result of such advances in technology. We will, however, see a technology adoption life cycle. And we are right now where I like to call the slope of enlightenment, where initially there's a huge technology trigger. We kind of reach a peak of inflated expectations, as we've seen with dentistry. You can see on the lower right where Google shows the trends of an initial spike in interest in telemedicine, and then a trough of disillusionment. Well, we can't really do root canals over the phone. We can't really do a lot of procedures over the phone, but really coming back up and realizing that, yes, there are tons of actual benefits and tons of services we can provide. And we're in the early phase of the slope of enlightenment. And you should see a continuous and gradual growth until we eventually lead into some kind of a plateau. But with the advent of so many new technological advancements and innovations, I think that we will be experiencing a long-term, slope, and really moving towards the early majority of the population that is now joining the telemedicine movement. Now let's see if teledentistry, for example, checks off the requirements for Uberization. It's certainly disruptive. Patients are now able to be contacted on their mobile phone. They can now find a provider at any time and from any location on demand. And it really also allows a direct connection between the patient and the provider within minutes. And patients have a freedom of choice of picking which provider and scheduling with that particular provider, and then leaving a review afterwards. It's interesting because I think every single one of the boxes is checked off as far as Uberization and teledentistry are concerned. It also allows full control back to the patients as to when and where and how they receive the services that they're looking for. It's certainly convenient. Patients can now access mobile and telemedicine services directly from the comfort of their home, their business, even hospices and hospitals, and really provides a better consumer experience because a lot of these patients can now not only meet the provider that they're going to be scheduling with, but also do it on their terms. Connection is an obvious one, and comfort, again, is something that is easily achievable by changing the environment in which the procedures are done. But shifting from that, there's some bonus points for the providers as well. Now dental associates, new graduates, and even dentists who are going to retire but still want to maintain some activity in dentistry can do so utilizing telemedicine. And dental hygienists and mid-level practitioners are now able to Uberize their own practices with the help of general dentists to whom they can refer patients that is outside of the scope of their work. Now, there's been tons of, information and articles about how there is this slow adoption of technology in dentistry. And really, this is multifactorial and has to do with a lack of platforms through which we can accelerate the adoption and introduce a lot of these new technologies to our ecosystem. And also a shortcoming in policies and policymakers' part to really help adopt a lot of these new innovations that are coming to the market. It's staggering to find that roughly 50% of dentists across the world are still using paper charts, and 34% of dentists are still using traditional film. And some of these statistics are just unbelievable. And this really is a testament to how slow sometimes the adoption of technology could be in the dental industry. The reality is, though, that the consumer demand is going to drive this adoption. And we're at a point where patients have to really take some crazy measures sometimes to get access to care. Most of our offices are closed in the evenings. Lack of access to dentists is rampant. And, believe it or not, 74 million Americans still have no access to oral health care. That's nearly double the number of people without health insurance. And only about 40% of the population even get a single annual dental visit. So while it may seem like we have so many dental offices popping up and there's such a competitive nature to to our industry, there's still a massive lack of access to care. And you'll see here an article where during the coronavirus shutdowns, many people, in fact, this is just one example, were forced to even pull their own teeth due to lack of access to care. Now, there's a huge paradigm shift occurring, and Dr. Paul Glassman, I call him the father of teledentistry, has really spearheaded this movement. But really, the statistics go back as far as, and the research goes back 20, 30 years about the efficacy of teledentistry, and that repeatedly has been shown to be efficacious in pediatric dentistry, in orthodontics, in oral medicine, and really interesting to find that telemedicine actually is increasing the busyness and the influx of patients to local offices. So the fact that we cannot do a variety of services like pulling teeth and root canals over telemedicine really will mean that a lot of these patients who are not seeking care and who are avoiding the office can now be introduced into a workflow that will allow them to be referred to local offices. And there's countless research that shows the advantages of teledentistry are clear, and that it will not only increase access to care, but really decrease the costs that patients have to incur in finding care. And for the sake of time, I'll let you go through the benefits of teledentistry on your own, but these are clearly listed on the ADA website. And really, in a quote here from the ADA is that the ADA believes that examinations performed using teledentistry can be an effective way to extend the reach of dental professionals, increasing access to care by reducing the effect of distance barriers to care. Unfortunately, we still have some states like the State Board of Texas who have, in spite of all of these benefits, have completely outlawed teledentistry. And thankfully, there are dentists and tele providers and legal teams now suing the State Board of Texas. And I think that this was a huge injustice to Texans, 40% of which who don't even see a dentist once per year, mostly relating to costs. And this is something that will change in the very near future. So let's talk about some of the problems that Uberization addresses. Imagine being able to receive care directly in your home or virtually. You can avoid traffic. You can reduce in-office wait times. As far as businesses and employment are concerned, many people who have insurance are still not going to the dentist, even though they have the financial means and the insurance coverage. And really, it's staggering to realize that 164 million work hours are lost each year just going to dental visits. Translating to billions of dollars of lost income for the industry. Now imagine disabled patients or geriatric patients and the logistics concerned and involved in going to the dentist, having to schedule transportation a week in advance, not knowing where they're going to come and pick you up within a 4-hour window, and God forbid a patient's treatment runs over, and imagine the logistics and having to pick up that patient and take them back home. And this is all for checkups and cleanings. What if we can do that work on site? And imagine the number of patients who are now being given opioid medications in emergency rooms and urgent care because there are limited amount of staff that can address dental emergencies. Just imagine the amount and quantity of anxious and nervous patients who just by showing up to the waiting room of a dental office, having their anxiety triple just by actually going into the dental office without even receiving any treatment. Imagine if we can address these anxiety issues and do a lot of these workflows from the comfort of their own home or through telemedicine. And obviously, we all know about the coronavirus and pandemic and the impact it has had on the dental industry and the amount of shutdowns and limited workflow capabilities we've had. Statistically, over 2.2 million people were showing up to emergency rooms and ER centers in the evenings for preventable, dental emergencies. And this is when most of the dental offices are closed, most of the dentists are at home, and there is limited access to care. And so patients have to wait 3 to 4 hours in a waiting room, only to leave with opioid medications and a referral to see a dentist. So the impact on our profession is clear, and we are still working to bounce back, from the effects of the pandemic, with lots of the, elderly dentists selling their offices, decreased amount of efficiency and capacity in our offices, and really telemedicine and the Uberization of dentistry will allow us to potentially regain some of that lost income and efficiency. And still, even before the pandemic, we had a massive lack of access to care. And here's a chart that'll show that there is still a huge room for improvement, and we believe that telemedicine and direct access to care will really help fulfill some of these gaps. Now, very proudly, the American Dental Association initiated a movement towards introducing telemedicine and increasing access to care through mobile dental care years ago, through the introduction of the Action for Dental Health Act, which passed several years ago in December of 2018, allowing mid-level practitioners more access to do on-site work. But now we're seeing a massive institutional corporate adoption from all of the major insurance carriers to all of the DSOs to retailers, and even the different dental boards that are really actively and proactively pushing the advancements in telemedicine, including coverages for these procedures and relaxed regulations. In fact, and interestingly enough, the American Association of Dental Boards had their annual dental boards meeting in February, and the diamond sponsor was Smile Direct Club. Now, regardless of anyone's opinion on Smile Direct Club, it is really motivating, and really, I'm really happy and proud to see the American Association of Dental Boards and all of the dental boards proactively engaging and working with telemedicine and teledentistry companies on how to properly introduce this to our profession, with the frame of thought that increase of access is paramount, and our fiduciary responsibilities to our patients requires us to bring in this technology in a way that is in the best interest of our patients and our profession. Now, healthcare is definitely going to follow retail. We are already seeing Smile Direct Club introduce pilot programs into Walgreens. And Smile Direct Club is not the only company. There are kiosks now that are going to be put inside of major retailers. And from Walmart to Rite Aid to Walgreens, we will see kiosks and local microsites where patients can go to take intraoral scans and to be able to immediately access a licensed dentist through teledentistry. And we have already begun implementing a dental component to these existing telehealth kiosks. Uber Technologies, as of a week ago, announced and appointed Caitlin Donovan, who has had more than a decade of management experience in dentistry, and most recently served as the COO of MyOrtho. So this is a clear indication that even Uber and Uber Health are now starting to think about how the beginning of the Uberization of dentistry will look like, and getting involved in the healthcare space. Now, one example of how we can introduce the Uberization into dentistry is through emergency care. This seems to be a low-hanging fruit, with over 2.2 million people going to emergency rooms. Every 14 seconds, someone visits a hospital or emergency room for a dental condition. And 70% of this occurs outside of normal business hours when all of us are closed. Patients end up paying about 3 times as much as they would in a traditional dental office. And these are high converting patients with lots of dental needs. These are patients who are oftentimes outside the Medicaid system and who have an accident and who need care, but end up receiving opioids and antibiotics because there is no access to dentists within the hospital setting. But can we do better? Can we reroute some of these patients directly from their mobile phone to a licensed medical provider or dental provider that is nearby and who can help, instead of them having go through the emergency care? And billions and billions of consumers now have mobile phones. Even some of the more underserved and underdeveloped countries have their lowest income populations have mobile phones. And so this is a great opportunity for us to be able to directly access patients and allow patients to directly access dental care directly on their mobile phone. These are tons of examples of exams that we've done through Dentulu, where you can clearly see abscesses. And sometimes we are addressing non-emergencies where a patient believes that they're having an emergency, ends up in the emergency room because there's a little bit of a bleeding or there's a discoloration. And this is an opportunity for us to say, no, this is not a true emergency. You don't need to flood the emergency rooms. And this is something that we can easily address at the office tomorrow. We can now prescribe medications, and by law in many states, we are now allowed to establish these patients as a patient of records, and through electronic prescriptions, send preventative antibiotics and whatever medications we deem necessary directly to their pharmacy, followed up by an in-office visit at the office. Now, really proud of the AOS and the Fast Track Hospital Aversion Program. As Dr. Javid mentioned, Dentulu and AOS have partnered now to help really do our part in averting a lot of these patients from emergency rooms by allowing consumers to find providers in their area with whom they can connect on demand. Providers will set up their own emergency hour services. They can be on call or go offline at any point they like. And this is a free service to all AOS members, and you can register to be part of the Fast Track program and really have all of these patients rerouted to you. And you can decide whether you want to take the call or not, but be able to help a lot of these patients, be able to do your part in minimizing the amount of emergency dental patients that go to ERs, and then also having tons of opportunities to acquire new patients who are high converting patients that need a lot of dental work. We've also incorporated dental carts within hospitals. So we are going to provide these emergency rooms in hospitals with mobile dental carts that have a high speed, low speed, pretty much everything you need to perform a variety of dental services, but also with a virtual link to local dentists who can then help the hospital staff be able to diagnose, do remote patient monitoring, and if necessary, be able to assist mid-level practitioners through general supervision to provide prophies and cleanings and preventative care. We know as dental professionals how integral oral health is with systemic health, and we have to be able to bring care and bring access to the location of patients. We owe it to our geriatric patients and disabled patients to really help maintain some level of oral health and decrease infections and the effects of their, of oral infections on their general health. There has been more and more research almost on a monthly basis showing how much IL-6 inflammatory markers and how much the oral health is related to systemic health. We've all known this, but really how have we taken a proactive approach to bring this care to patients on site where they're located and really address the disparities that exist with geriatric patients and disabled patients. And this is one way to do so. These carts are simple with a simple x-ray, nomad, and perio charting capabilities. And with intraoral cameras, we can now really provide great general supervision and bring a lot of this work on site into hospitals, hospices, and other locations of need. Now, the flow really is consistent when providing teledentistry and telemedicine services. On the patient side, the patient needs to be able to register, review the different doctors, and select the doctor of choice, book an appointment. They receive a confirmation that their appointment is booked. They can then interact with the provider of choice, choose a payment method, and then once the interaction is over, leave a review. And for the doctors, there's a very similar workflow. They sign up, they fill out their own professional details, they create an availability. They basically will receive requests for appointments. They will review those requests and approve that appointment. Then they will then engage and interact with with the patient, and from there they receive payment. And if necessary, they can provide prescriptions or make a referral to be seen in office. So let's go through an example of the patient experience here. So here you see a patient can now register on their phone or on the web. They can, add additional family members, even decide the a preference of gender for the provider. They can fill out their health history. They can fill out their insurance information, provide different addresses where they may want to receive on-site care. They can read and review treatment plans. All the forms are now digitized so they can sign their consent forms directly on the platform, and they can engage providers in video conferencing or photo consultations where they can submit a photo, and this photo will be reviewed and reassessed through asynchronous teledentistry, and they can also control their appointments. So here you see browse dentist by category, choose a dentist, pay and connect, and patients will now be able to really look for the types of providers that they're looking for. Whether it's a cosmetic dentist, a holistic dentist, a pediatric dentist, they will see a list of these different types of providers. They will now be able to see the rating on those providers, view their profile, see their availability, and be able to really decide who they want to go with, give access to their chart on demand when they want that doctor to have access to that to their personal health information, and then go ahead and sign consent and pay for that treatment or pay for that consultation, and then within a couple of minutes be connected to the provider. So imagine having an emergency and being able to connect to a local provider who can address your emergencies within 5 to 10 minutes, or having to now go on Google and Yelp and trying to decipher who to go to, traveling to that emergency room, or having to really figure out who to go to at 10-11 p.m. when you have an emergency. Now, telemedicine and the Uberization of dentistry really also includes remote monitoring. We have amazing companies that have really nice products that will allow you to now visually see inside the patient's mouth. Holland Healthcare has a device that can be attached to your telephone and will show you some of the most crisp images you've seen. And you are now able to not only measure distances, circle particular areas of concern, but also then transition into a telemedicine visit and an in-office visit with a local dentist. And patients are able to self-monitor and educate themselves through consumer intraoral cameras. These cameras are a product that Dentulu is bringing out called the Mouth Cam, and these are very affordable, between $25 to $99 for an intraoral camera, which allows patients to actually see inside their own mouth. It allows the providers from thousands of miles away to be able to see inside their patient's mouth, and can really also be beneficial for post-operative monitoring and evaluation, as well as early detection of cancerous lesions, open margins, and really will play an integral part of remote patient monitoring in dentistry. In the future, this will be combined with artificial intelligence, allowing patients to literally scan their own mouth and be able to alert them if an early cancerous lesion is suspected, if open margins are seen, if plaque accumulation has reached a certain point, thereby triggering a consultation with the local dentist. And here you'll see how easy it is. These are wireless and can hook up to the patient's mobile phone, or can be connected to a computer, allowing the patients to see inside their own mouth and allowing the providers to remotely view the healing process or state of condition of the oral health of their patients. As we mentioned, artificial intelligence will play a huge role in early pathology identification. We can see if our implants are, having issues. We can see if threads are becoming exposed. We can see if there are early cancerous lesions, and eventually we'll be able to see the periodontal status of the patient as well, long after they leave. So if our implants are failing, we may now be able to tell why. We may be able to see why a patient's prosthesis is failing, and how they are doing their part to be able to maintain some of these prostheses. Another exciting part of telemedicine is the emotional recognition in cosmetics. Through artificial intelligence, we can now tell a patient's emotional state in real time as we talk to them. We can see if a patient is happy, nervous, sad, anxious, fearful, um, or motivated to get what we are recommending done. And equally, we can now see facial proportions and be able to create better cosmetic outcomes based on uh, the, the help and assistance of artificial intelligence and machine learning capabilities. So, Uberized dentistry and on-site dentistry, really want to touch on that because we will now see a huge push towards mobile clinicians and mobile dental offices. Patients and consumers now have the capability to uh, basically go online through Dentulu. They can basically put in their zip code, put the location of choice where they're seeking services, and even put in the type of services they want to receive. And in many states now, we have mobile clinicians who, instead of uh, purchasing a $700,000-$800,000 brick and mortar dental office, can now purchase a mobile uh, dental office and travel directly on site to the patient's home and be able to address whatever issues there are right then and there, and see the whole family in a completely different environment. Mobile dentistry is going to take a huge uptick in senior living centers, in businesses where we have companies now currently offering on site dental work in a conference room at major corporations who already have PPO insurance. Much of these procedures are already covered, and patients can now benefit from having on site work done without having to leave work. 164 million work hours were lost uh, last year to just traveling to the dentist. And, really, corporations are realizing that they can increase the efficiency of their businesses and really ensure that their staff are getting the care they need to reduce absenteeism from work as a result of dental emergencies. So not only do they have the dental insurance, they have the PPO plans, but we can now just pull up with a truck outside of major corporations and even local businesses, from banks to libraries to corporations like Google and Netflix, and we can either do their preventative care and screenings directly in a boardroom in a pop-up dental environment, or we can do this in specialized vehicles that we can park in the parking lot, and the employees can just come outside, go inside the truck, get the care that they need, and then go back inside to work. Now, this is a huge opportunity to screen patients for cavities. We're now using intraoral scanning to be able to take digital impressions of patients just in case they need night guards, whitening trays, clear aligners. And we can now funnel these patients directly into local dental offices where they could be treated by local licensed clinicians in a brick and mortar office. This is definitely not um, competition to local and brick and mortar offices. And really, we have to change our frame of thought and realize that a lot of these patients are already avoiding the dentist. They are not going to the dental offices, even though they can afford it and they have the coverage. And statistically, time and time again, through research, it has been shown that these will actually accelerate uh, patient referrals to local brick and mortar offices, well, where the majority of dental work really still has to be done. So we're far away from having procedures like dental implants and other procedures done on site, and really at this point focused on preventative dentistry, evaluations, and emergency care. Universities across the nation and across the world are now adopting telemedicine and on-site care services for their students. Uh, Mobile, specialized mobile vehicles will show up, uh, and the students will be able to receive preventative care, and the parents of the students will be able to monitor a lot of this stuff. Should they want to stay engaged in the oral health of their kids, the parents can now, through telemedicine, be involved in the oral health care of their children, and really ensure the well-being of their kids, even if they are far away. in college. Um, Hospice and senior living centers is really where this uh, you know trend really began, bringing on-site access to hospices, nursing homes, and even elementary schools. Really has received a tremendous amount of support from these organizations, but also from the dental boards, the ADA, and this is really what spearheaded the movement towards mobile dentistry and teledentistry. But we're now realizing that it doesn't have to be limited to disabled and geriatric or pediatric patients. That a family of 5 or 6 with multiple kids can equally benefit from bringing on-site dentistry to their home, and really decrease uh, the amount of wasted time they have to uh, put towards traveling to the dental office or finding babysitters, and really also increases the efficiency of dental offices who are engaging in mobile dentistry by having a mobile component or a telemedicine component. They can free up their chairs, they can increase productivity in their offices, decrease PPE costs, and really now take advantage of a lot of the billing that the insurance carriers are allowing us to really utilize. About a year and a half ago, none of this stuff was billable events. Now we can actually use certain codes to bill for telemedicine procedures. Um, so if we are going out on site and providing care, not only can we charge for the actual dental work that's done, but in many cases, we can now see additional income from the utilization of telemedicine. So, really, again, I think an initial part going back to senior centers and mobile dentistry was just realizing and putting ourselves in the position of our patients. Some of our patients who we've treated for 20, 30 years who are now disabled and unable to come to the dental office. We can maintain that continuity of care and maintain those relationships by simply just bringing the care to them. Here you see on the lower left a simple pop-up chair and a mobile cart is being utilized. All of this is accessible to hygienists, to dentists across the nation. You can put all this stuff inside of your trunk or in the back of your car, or create a mobilized, van that can carry this for you, and you can brand it. But the point is that these types of pop-ups can be done anywhere. It could be done in a living room. It could be done in a boardroom, and it's really easy to implement and very cost efficient on the dental side. But the amount of money that it will save patients who have to pay for transportation issues, and this is partly why Uber is getting into this, because there's a huge demand and huge potential to serve a growing number of patients by helping out in those logistic issues as far as transportation to the dental office is concerned. Again, here you see pictures of nursing homes where the hygienist, the dentist, or mid-level practitioner can now go and see 20, 30 patients, full schedule. And a lot of these patients, again, have insurance already. So that barrier to cost is not something that we have to really, focus so much on because a lot of these patients already have coverage and are more than willing to pay for the services that they receive. So we get to do what we do best, and what we really want to do at the end of the day is good dentistry and help people and really decrease oral health disparities that exist in these types of communities. Here you'll see companies, who just want to increase efficiency. This is Dentulu providing corporate wellness directly inside Patient Pop. So here we have a patient. We actually set up a pop-up. You can see there's a dentist, multiple assistants. We also have a hygienist, and we had a full schedule set up, allowing the hygienist to basically perform hygiene services. The dentist can do minimal dental services here as well. And then for the more advanced procedures, all of these patients were then funneled into local offices that can address some of the more invasive procedures that require to be done. And, as I mentioned, the Uberization of dentistry is going to bring uh, convenience directly to consumers. And here you can see a very simple pop-up. This is pre-pandemic, directly inside the living room of a patient. A chair is popped up. A mobile dentistry cart is, we basically carted in, and everything is done to the same standard of care that you would expect in a dental office, from perio charting, complete oral health evaluation, oral cancer screening, and the general dentist still evaluates and authorizes any procedure that requires to be done. But with mid-level practitioners more readily available and willing to actually go on site, dental offices can now commission hygienists to go out directly inside the consumer's home, provide preventative dentistry, provide hygiene services, and at the same time pre-screen these patients for restorative work, which can then be funneled back to the doctor's office. Now, we have also really seen a huge expansion in mobile dentistry, but in these outfitted mobile, vans. Henry the Dentist, who just got acquired by ONSITE Dental, is an example of a mobile DSO that is now really proactively pushing mobile offices that can travel really anywhere. Look how beautiful this office is. This is innovation. This is really the entire dental ecosystem changing before our eyes, and for the best interest of patients. You can see, multiple operatories in a vehicle that can pretty much go anywhere, parked inside the parking lot. And you'll also see on the left, Dr. Blend, who, provides a similar service, but inside of a smaller vehicle with his, mobile cart that can go inside any small room or workspace and create a quick pop-up location, provide the services that are necessary, and then go back to another location. We'll also see a huge the Uberization of imaging and diagnostics. So we can now not only take intraoral scans remotely, but we can take, CBCT and a whole number of other diagnostic tools that we need as dentists to really be able to provide care. And even if you don't participate in mobile dentistry, if you have patients who are geriatric patients, disabled, or just busy, you can take advantage of mobile CBCT and cone beam companies that will actually go on site, provide this care, and get the diagnostic information necessary for you to be able to enable your own workflows. So some offices don't want to invest in cone beam technology, but the Uberization of dentistry really also includes diagnostics, and this is something that offices across the nation will be able to utilize, and provide this on-site care to their patients. Now, Dentulu is working with the AOS to create a national registry, a free directory of mobile clinicians, because there are so many mom and pop practices that are now coming to market. Dentulu has created a free directory, and by the way, all of our teledentistry capabilities are also free to providers. So anyone who's interested in mobile dentistry or teledentistry can now take advantage of all these services and register for free. Providers can either go online on Dentulu's website or download the app directly onto their mobile phone. You can register as a dentist with or without a dental practice. Hygienists can register for their own types of accounts, and dental offices have a completely different account. But these are all free services that partnerships like the AOS, Dentulu, and many other companies have come together to provide our professionals to be able to test out and really implement some of these capabilities at the rate at which they feel comfortable and not really have to worry about incurring a lot of costs. All of these telemedicine capabilities, from synchronous video calls to asynchronous teledentistry, to photo consultations, to mobile dentistry, all of these have been put on one platform that is HIPAA compliant, SOC 2 compliant, and really can be implemented at the degree and comfort of the provider. So a dentist or a hygienist can now create an account, become verified. They can, if they want to start participating in mobile dentistry, they can put the different zip codes where they are willing to provide on-site care. You can even customize your availability if you want to provide emergency calls, if you want to provide non-emergency second consultations, or if you just want to provide mobile dentistry, you can customize different calendars and schedules for those particular types of procedures. You can also customize your fees. So you can charge whatever your customary fee is for both teledentistry and mobile dentistry visits, and sign a BAA, get your W-9 done, and basically at this point, a patient can register. Consumers are being driven onto the platform. Um, they can look for your services. They'll see a profile. They'll see when you are available and the type of procedures that you provide. And if you as an office owner don't really want to do this yourself, you can always have an associate work underneath you and provide these services and really go out there into the community and then bring these patients back to your office. So a patient will choose the provider, schedule an appointment or request an appointment. They can even request specific services, and then they can also request appointments for family members as well. So really, teledentistry and the Uberization of dentistry is, in its early stages, and it's going to be a rising trend in our profession. I can assure you that it's here to stay, and it's only getting bigger based on the conversations and movement we see with major retailers, with the American Dental Association, the dental boards, and the insurance companies, and really mainly driven by consumer demand. As we see the Uberization of other industries, the consumers and our patients will demand this. And it is really imperative that we as professionals begin to get involved in the early adoption of this so we have a say in how this is shaped. And if we don't get involved as dental practitioners, we will have corporations and outside interests get involved in an attempt to monetize this, and we will lose control of the potential benefits that this can provide to our patients and to our offices. Um, Patients have already stated that they would continue to use telehealth. 60 million millennials would support telehealth to even replace office visits. So you can see the amount of demand that there is from the millennials. Um, you know, 64% of even adults are willing to have a telehealth visit. And I think almost all of us are now accustomed to having that option presented on the medical side. And really what we've seen based on the experience is that the majority of patients are willing to do it again for the convenience factor. And I don't think that this is going to be an exception in dentistry. I think that this is just going to continue in dentistry. And as more dentists get involved, we will see more and more adoption, not only here in the United States, but worldwide. Now, studies by DentaQuest have shown that uh, you know that 30% of the providers that have been seen via telehealth are ready to use it again, and you know just continued support and reiteration that this is a viable treatment modality, both in efficiency, both in uh, access to care, and in decreasing costs, and that many of the patients are finding this experience really enjoyable and want to do it again. You can see here 86% said they would use teledentistry again. Um, 93% were able to easily understand what the dentist conveyed to them through telemedicine, and that 86% would recommend teledentistry to another person. And so this is going to be a great opportunity for us to really decrease expenses, access more patients, acquire more patients, and also retain more of our patients through remote patient monitoring, and really limit the amount of COVID exposure in our offices while decreasing, uh, you know, uh, decreasing some of the challenges we've had with, with COVID pandemic really affecting our efficiency and the amount of patients that we're able to see. So, can this be consolidated, integrated, and affordable? We've already shown that this can, and we have more and more of these companies coming together to be able to offer all of these different types of services completely free and completely consolidate onto one platform. So I invite everyone to join the AOS or go directly to Dentulu. You guys will be able to find and register free access to these telemedicine services, and really invite everyone to just do it. I would like to show you where you can find this on the Fast Tracks website. You can go to oralsurge.org, go to register, and press the Fast Track Emergency Room program, and immediately you will be provided free access to all of these services, all of the teledentistry and telemedicine services discussed, and be able to create a calendar and schedule for yourself, and immediately begin having emergency room patients and a variety of other patients routed to you for early diagnosis and patient acquisition, and hopefully will allow also to generate more revenue in our office by billing a lot of these telemedicine options. So with that said, I want to thank everyone for their time, and really thank AOS for bringing this important information and this progressive information to its audience, and really hope to be able to answer any questions that anyone else has in the future regarding mobile dentistry and teledentistry. So thank you so much, and Javi John, I'll
Thank you so much, Dr. Hakhamian. It was a wonderful presentation, very insightful. It's amazing what we can do with this technology, and obviously you went through every little bit of it, explaining that. We appreciate you very much. Thank you very much. We're kind of running out of time, but we appreciate if you could check back a little bit later on this chat site and see if there's any other questions. If you could respond to those.
Sure,
So just
put my email up, and if there's any questions, I'd be happy to answer them. As you know, we can share my email and information, and if anyone has follow-up questions, I'd be happy to give them my direct information.
Thank you, Dr. Hakhamian. You have a wonderful day. We appreciate you.
Thank you so much. Bye-bye.
Bye-bye.